Hey, I'm Dr. Jones. I'm a pediatrician specializing in Black health and wellness, and today we're going to be talking about diaper rashes. There are two common types of diaper rashes that you might notice in your small infant or young toddler. The first is a bacterial diaper rash. So this usually comes because everybody has bacteria that lives on their skin normally. It's part of what keeps us healthy. But if your child has wet diapers that irritate the skin, then the small breaks in the skin are areas where the bacteria tends to overgrow. And so that can cause a painful red, very irritated diaper rash on your child's buttocks and sometimes around their genitals. The other type of diaper rash that's very common is a fungal diaper rash. So this is caused because, fungus also lives naturally on our skin, but because your child is wearing a diaper, and fungus usually grows in a very dark, moist area, and so that's the perfect environment within your child's diaper. So because they've got a wet diaper on, it's dark, it's very warm in there, that allows the yeast or the fungus to grow out of control. Usually the fungal diaper rash is not painful. It just looks very bad. So you might see like red spots on your child's genitals. If it's a girl, you might see it around their vagina. If it's a boy, you might see it on their testicles. You'll also see red bumps around their buttocks as well. And then even in their growing area, you might see bumps there. But you'll notice that when you touch it, your child doesn't really react because it's not a painful rash. Being in a wet diaper for prolonged periods of time definitely increases the risk of developing either a bacterial diaper rash or a fungal diaper rash. The other thing that increases the risk of a bacterial diaper rash is if your child has diarrhea. So if they've become sick with a little stomach bug and they've had diarrhea for 3 or 4 days, you might start to see that break in the skin that allows the bacteria to overgrow and cause that irritation and pain. The way to treat the fungal infection is to use a cream called nystatin. Nystatin is the #1 treatment for candidal or yeast infection diaper rash. If your child has a bacterial diaper rash, they might need an antibiotic. There are 2 types of antibiotics that your child might need in order to clear the bacterial diaper rash. So one is a topical, that means it's an ointment, and you would apply it for about 5 days. And if the diaper rash is really bad, then you might need the topical antibiotic with an oral antibiotic like amoxicillin in order to cure that skin infection. But as soon as you notice a diaper rash on your child, try to get them to the pediatrician because early treatment can help it resolve sooner rather than later.